Dear Chairman, thank you for the invitation to present at the EBC 2010 annual meeting. The title of my presentation is Feasibility, Safety, and Efficacy of Drug-Coated Balloon-Only Treatment in Left Main Coronary Stenosis. Left main disease with diameter stenosis over than 50% requires revascularization to improve the prognosis. Among them, PCI is recommended as class 2A up to a syntax score of 32. Drug-coated balloon is basically working as a balloon angioplasty mechanism, so we need to know the balloon angioplasty effect. The Benestant 1 RCT compared balloon angioplasty to bare metal stent, and there was no difference in hard endpoints such as death and myocardial infarction. Only repeat PCI was more in balloon angioplasty group. It is due to restenosis, which can be resolved with local drug treatment like drug-coated balloon. To resolve this problem of balloon angioplasty, bare metal stent and drug-eluting stent were developed, but hard endpoints such as death and myocardial infarction were not improved. Then what about drug-coated balloon? Can DCB improve outcomes in this era? We performed PCI in 42 consecutive patients with left main disease. In patients with adequate balloon angioplasty, 23 patients were treated with drug-coated balloon, and the remaining 19 patients were treated with DES. The mean age was 63 years old in DCB and 67 years old in DES, and the most of the patients were men. There were mainly unstable angina patients, and there were 3 acute myocardial infarction patients in the DES group. The syntax score was higher in the DES group, median value 27.5, and cerebral disease was also more common, 68%. In both groups, most of the patients were bifurcation lesion. The mean DES diameter was 3.7 millimeter, which was larger than the drug-coated balloon 3.4 millimeter. And IBUS was almost used in drug-eluting stent group. There was no beta of stenting in DCB group. In the QCA of 23 DCB treated patients, diameter stenosis at baseline was 72%, and post-DCB was 30% residual diameter stenosis. In follow-up, the follow-up duration is around 6 months. Diameter stenosis was unchanged at 31%, and lay lumen loss was 0.1 millimeter. One patient had binary stenosis. We successfully retreated it by drug-coated balloon again. In drug-eluting stent, one patient died from myocardial infarction. This patient had already had a left main myocardial infarction when he came to our hospital and died several hours after stent PCI. After 1 year follow-up, there were 2 target lesion revascularization in drug-coated balloon and 2 events in drug-eluting stent, including 1 cardiac death and 1 cerebral hemorrhage. This is a 61-year-old man. He had a very tight stenosis in the left main bifurcation. After check by IBUS, balloon angioplasty was performed with the left main to proximal RAD and treated with a drug-coated balloon. Although some residual stenosis remains, the procedure was finished because the lumen was much bigger than baseline. After 6 months, left main stenosis was not observed. This patient has been well for 3 years without any angina symptoms. This is a 57-year-old man and has a left main CTO. After wiring, angioplasty was done with a small size 1.5 millimeter balloon first. After ballooning, floor appeared. I did sequential balloon angioplasty, increasing balloon size. After that, the floor improved a lot. I also performed the drug-coated balloon for midway RAD, this tight region. I did several balloon angioplasty with optimal sized balloon from left main to RAD and from left main to LCX, followed by drug-coated balloon treatment. This is a final result after drug-coated balloon treatment. After 6 months, left main trifurcation region were much dilated and it looks normal coronary angiogram. So we successfully treated left main CTO trifurcation lesion with the drug-coated balloon only treatment. The patient is currently doing well without any symptom for over 1 year. This is a target lesion revascularization case. A 45-year-old man with very tight stenosis of left main shaft and decreased antegrade flow. It's just a TIMI2 flow. After balloon angioplasty and drug-coated balloon treatment, the lumen increased significantly and the flow was normalized. TIMI3 flow, his angina was gone. However, the patients had follow-up loss after discharge and was voluntarily discontinuing all drugs, including antiplatelet drugs. After 6 months, chest pain developed and left main disease recurred. Because he had full drug compliance, we retreated the lesion with a drug-coated balloon. This is a follow coronary angiogram. Follow coronary angiogram showed good result without recurrence after 8 months. Now he has no symptom. So why do we have to work so hard for drug-coated balloon? Short duration of dual antiplatelet therapy for patients of full drug compliance, especially in young men. For high bleeding risk patients, and drug-coated balloon has no stent-related event like stent thrombosis. And you may have the opportunity of bypass surgery or biologic treatment in the future. Here is the take-home message. The purpose of PCI is to reduce death and myocardial infarction. Drug-coated balloon treatment is increasing with a low rate of hard endpoint, death and myocardial infarction, and acceptable rate of clinical outcome in left main disease. And DCB treatment without stenting is feasible and well-tolerated method for the novel left main lesions if the pre-dilation result is good. However, we need randomized and controlled trial, and it's necessary to further evaluate the safety and efficacy of drug-coated balloon treatment in left main disease. Thank you for your attention.